Good afternoon. My name is Donna Everett. Today's presentation is on a teaching plan for chemotherapeutic medications. One of the first things that we have to do as nursing educators is to look at the time limit or the time allotted that we have to cover the assigned material. My presentation was given 3.5 hours, and that includes time for the lecture with the PowerPoint presentation, student activities, the student learning activities, and student breaks. So we need to look at the amount of time we have and make sure that we can realistically cover the content in that time frame. The next thing we need to do is to look at the learning outcomes. Make sure that our outcomes are realistic and that the information or the assigned content covers those learning objectives that we wish the students to learn. The evaluation method should be appropriate for the material also. For my teaching presentation, the students were given an assignment prior to class, and that was to read a chapter on anti-cancer medications in the pharmacology book and to watch a YouTube video titled Learn About Chemotherapy. Giving them pre-reading or pre-classroom assignments kind of gives them an overview of the information that will be covered. That way they're not coming into a classroom with no idea about what the topic is. With chemotherapeutic medications, ensure that we are realistic about what we expect the students to learn. Students typically are not allowed to administer chemotherapeutic medications in a clinical setting. Most of them will not administer chemotherapeutic medications even as a nurse unless they work on the oncology unit. But it's still very important for students to know about these medications. They need to know what the side effects are because they may, even on a med-surg unit, be taking care of these people or these patients. If they work in a home health setting, any area, they may come in contact with patients who are receiving chemotherapeutic medications. There is many different classifications of chemotherapeutic medicines. The drug book lists 10 different classifications. Today we will go over specifically 3 classifications with the students and 4 different specific medications. The most common is the alkylating agents, and with that we will teach these students on cisplatin, the anti-metabolite medications, and this is medications such as methotrexate, and it's actually given PO, and it's one the students may come in contact with on a more regular basis because it's also given for other things other than cancer. It can be given for rheumatoid arthritis. And then there's hormonal agents, and those include such things as Megace, which is not often but can be given to increase the appetite. And there's tamoxifen, which is typically a breast cancer medication, but it can also be given for other things too. So we need to look at what we want the students to learn. They need to know specific medications, but they need to know the general classifications too. What do they need to come out of your classroom knowing? The next thing that we will go over is the indications for these chemotherapeutic medications. Of course, all these chemotherapeutic medication drugs are given for cancer, and there's many different types of cancer. Then you have the lymphomas and the leukemias, and then there are certain chemotherapeutic medications that are given for certain or specific autoimmune disorders, such as rheumatoid arthritis. When we go over the indications for the use of the chemotherapeutic medications, the students will be given a worksheet, just a fill-in-the-blank worksheet that they can fill out either from their prior knowledge from their pre-reading, pre-classroom assignments, or during classroom as we are going over the information, that they can fill in these blanks and use this sheet as a study guide later on for their test. Students should be able to identify the contraindications of giving these medications. And some of the common contraindications, of course, is pregnancy, because chemotherapeutic medications can cross the placenta and cause damage to the fetus. Lactation, if you have a patient who is attempting to breastfeed, some of these medications can be passed through the breast milk to the infant. So that's things that the nurse and the physician should be aware of, and a lot of patient education can go into that, teaching the patient which medications can and cannot be taken with breastfeeding, because the patient very well may have to quit breastfeeding in order to take the chemotherapeutic medications. You may have patients with bone marrow suppression. These patients are already immune compromised, so you may not be able to administer the chemo medications to them. If they have severe neutropenia, this puts them already at risk for infections, but people with severe neutropenia do not receive their chemo drugs. So typically, if you have a cancer patient who is coming in to get the chemotherapeutic drugs, they will have lab tests done prior to the medication being administered, and based upon their lab results, the physician will determine whether or not that patient can receive the chemo drugs. And then, of course, if you have a patient who has a hypersensitivity to the medication, then of course they would not get it. When we go over the contraindications, a good thing would be just to have a simple question and answer session with the students so that you can clarify any information that the students may have that is unclear to them. And you could even do the muddiest point, have the students at break time write just a quick synopsis of anything that they think is unclear, and then go back over it after the break time. And then, of course, now we will go over the adverse reactions. Of course, the list that we go over with the students is not all-inclusive, because each specific medication will have specific side effects that may be exclusive to them only. But a lot of these medications in general have some common side effects, and some of those are the bone marrow suppression, which would lead to different low cell counts. The students need to know about these and what to look for. For stomatitis, the irritation in the mouth, nausea, vomiting, diarrhea, which will alter this patient's ability to maintain nutrition potentially. Hair loss, a lot of the cancer patients will experience this as a side effect of their chemotherapeutic medications. They need to know that this, for the most part, is an expected side effect. They need to know emotionally how to deal with this. Not that we can actually teach them how to deal with it, but we can let the students know, talk to the patients about it. Don't let it be something of, oh my God, it's that shouldn't happen. The cancer patients need to know, it's very possible that you'll experience hair loss from a little bit of thinning of the hair to complete hair loss. And of course, you have the side effect of neutropenia, which is the low neutrophil counts. These patients have a low white blood cell count that puts them in a very high risk for infections. And then thrombocytopenia, which is the low platelet counts. These patients would have a very high risk of bleeding. So students need to be aware of what those words mean. You have the neutropenia and you have the thrombocytopenia, but past knowing the definition of what they are, students need to know what to look for. If they go into a room and they're caring for a chemo patient, what would I expect with a neutropenia patient? They're at high risk for infection, so there would be things such as reverse isolation that may be in place. The students need to know how to apply this knowledge. Although they may have the knowledge of what it is, they need to know what to do about it. How do they treat the patients who have this? Following the side effects, students before their break would be asked to complete a 5-question quiz on Canvas, which the answers, of course, with Canvas is just a wonderful system that will give us the answers, and at the start, right before we start back into the next section, after their break, we can go over the correct answers with them, and this will kind of give them an idea of what to expect test-wise, and also give them some things to think about. Some of the nursing implications for these medications, or for cancer patients in general, is to monitor their vital signs, specifically their temperature. If you have a patient who has neutropenia and they have a low white count, it's very important to monitor them for an infection, because if they start developing an infection, the sooner we can get treatment initiated, the better the prognosis for that patient is. Then there's reverse isolation. These students, the nursing students, are the future nursing workforce, so it's very important that they understand their responsibilities in caring for patients. Reverse isolation, the student should know and understand that it is for the patient's protection. It is not to keep us as nursing faculty and nursing staff from getting an infection from the patient, but to protect that patient from getting anything from us. Um, Assigned on a unit, that nurse may care for 4, 5, 6 other patients and going in and out of rooms. Other patients may have infections. Um, just touching surface areas and carrying bacteria into a patient's room. So it's very, very important that students understand what reverse isolation is, why it's an important implication or an intervention to have in place. Because most of these chemotherapeutic medications will alter their white count and it will put them at a risk for infection. It will basically make the patient have an immunocompromised situation. So the students need to, that's one of the very important factors to let students know. INOs, intake and output. We need to know how much that patient is taking in and how much they're putting out. Some of the chemo drugs can affect kidney function, so therefore we need to monitor their output. Intake, they're at a risk for dehydration if they're especially if they're experiencing nausea, vomiting, or diarrhea. So we need to monitor this. It would also be a great idea to do daily weights on these patients. Then you have your antiemetics. This can be one of the best prophylactic interventions that we have. They can be given PRN to help, or on an as-needed basis to help control nausea and vomiting. But that may also be given routine, depending on each patient's situation. If you have a patient who's experiencing nausea and vomiting at every meal, some patients may get nauseated at the smell of food. It may be a great intervention if the physician orders it, or have the nurse talk to the physician about giving it prophylactically. You can go in and give something like Zofran as an antiemetic and give it 30 minutes before meal times. And that way it's working. By the time the meal tray shows up, the patient is actually already medicated. The same thing as far as education. These patients may have medications such as Zofran or Phenergan that they can take by mouth at home, and they can be educated to take these before meals. And of course, pain control. Pain control for some of these patients, depending on their diagnosis, is very important. Efficient pain control or effective pain control can make the difference in improving a patient's quality of life. If a patient is in severe pain, they're not going to feel like getting up and moving around and interacting with others. There's a fine line between pain control and altering their ability to function. You don't want a patient sedated, if at all possible, but you do want them to be somewhat comfortable and comfortable enough that they can interact with others. Some of the nutritional interventions that we can put into place, if you've got a patient receiving chemotherapeutic medications who has had a lot of weight loss, you can offer small, frequent meals, supplements such as Ensure or Boost, high-calorie foods, high-protein foods. Encourage them to snack between meals. Anything that we can do to help them increase their intake. Some of the lab results, it's up to the physician to monitor those or to order those labs, but we need to specifically watch the CBC, and in that we'll tell you the white blood count, the hemoglobin, the hematocrit, the neutrophils, the platelet levels. All of that is important to look at where the patient's status is. A comprehensive metabolic panel, which will tell you the electrolytes, their potassium, their sodium, calcium, and magnesium. And at this time, the students can be divided into groups and a game of Jeopardy can be played. Prizes such as candy, students love free things, free ink pens, but specifically just little happies, candy, anything that will keep them motivated to pay attention and to participate. Then the students can be divided up into groups and be given patient teaching for their student presentations, and let the students participate. It's very important to have different learning activities. Personally, I learn better by a lecture, so I love lecture with PowerPoints. But all students have a different learning preference, so it's important to identify what their preferences are, have a variety of learning activities. So the student presentations, they can present patient teaching. And some of the things that would be important to go over would be infections, um, things that they could teach the patients on preventing infection would be to avoid large crowds when they're out from in a home setting. Avoid family members who are sick. Let them know, tell family members, I'm sorry you can't come visit if you're sick, if you have a fever, an infection, a stuffy nose, because the last thing that cancer patient needs, or any patient receiving the chemotherapeutic medications, is to get an infection. It can be life-threatening for them. The patient can be informed they can wear a mask when out in public. If we're taking them if they're hospitalized and we're taking them from their room down to x-ray, we can put a mask on them. They can ask for a mask if they're having to go to their doctor or physician and having to sit in a full waiting room with a lot of people. Tell them to ask for one of those little simple respiratory masks, and they can put that on and will help, especially if it's during like flu season, if there's been viruses and such going around. It's very important for them to protect themselves. And of course, always to let them know if they start running a fever, showing any signs of infection, to contact their healthcare provider if they're at home. Nutritional measures, I've touched on that, but you can teach the patient eat small, frequent meals. Bland foods may be better tolerated than something that's spicy or greasy. Avoid foods that have loud smells to them. Eat high calorie foods, high protein foods. They can snack between meals. Anything that will help them increase their intake and to maintain their weight. And it may be teaching them, take your antibiotics 30 minutes before meal times. Let them know, that's okay. If you're experiencing nausea at every meal, go ahead and pre-medicate before mealtime to help with that. Teach them the adverse effects of medications. What can they expect as far as side effects? Like I said, hair loss may be one of those expected side effects, but let them know, it may occur and it's a normal occurrence. It's a common side effect. But let them know what symptoms needs to be reported to the physician immediately. If they start running a fever, which could be a sign of infection, but also with the thrombocytopenia, the side effects, look for a lot of bruising, nosebleeds, um, any little cut that will not stop bleeding, anything that might indicate that they may be hemodynamically unstable, let them know that they need to report those symptoms to the physician immediately. They don't need to wait until their next appointment time. Of course, one of the important areas is contraception. If you have a patient who is of childbearing age, students need to know these patients need to be instructed to know you really do not need to get pregnant while taking these chemotherapeutic medications, because there is a risk to the fetus or to the infant, because some of these do cross the placenta barrier. So we need to make sure that they know to use an effective form of contraception. And if they're just persistent that, they're wanting to do family planning and they're wanting to have a baby, then let them know they need to talk to the physician and talk to the physician about what the consequences may be, because there have been instances where patients have had to stop their chemotherapeutic medications in order to maintain or to have a pregnancy. For the male patients, chemotherapeutic medications can sometimes alter fertility. So the male patients may be interested in possibly freezing sperm for years later. And then vaccinations. It may be safe for the patients to receive some vaccinations, but vaccinations such as the shingles vaccine is a live virus, and you do not want patients who are potentially immunocompromised to take a vaccine that contains a live virus, because this may initiate an infection in them. So it's something, if they're specifically wanting a vaccine, that needs to be discussed with the physician. But typically, they will not receive vaccines, especially if they have a live virus, while taking these medications. And then over-the-counter medications. These patients need to be informed. Don't take anything over the counter without talking to their doctor because it could potentially have an adverse reaction or interact with their chemotherapeutic medications. So any over-the-counter medications that they um, want to take needs to be discussed with the physician prior to them taking those. And then, of course, the students would be given time to prepare for a post-test exam. But then this would also be time at the end of the class time to let them know, is there any other questions? Are there anything else that you want to discuss? Is there any items that need clarification? Because we are educating the future nursing workforce. So it's very important that not only do they pass NCLEX, but that and they pass the course that we're teaching, but that they become effective nurses working in the workforce. So we need to make sure that they receive the education they need. And in doing that, we need to look at our teaching plans and make sure that we are doing our job as nursing educators to make sure that they get the content that they need. I hope you have enjoyed today's presentation. It has been a wonderful topic for us. Thank you.